Mental health is an extremely important issue. It's something that affects people of all ages, including older adults. Here with us today from Caring Connections, which is a part of the Gibson Area Hospital and Health Services, is program therapist Kara Niebuhr and program nurse Amanda Justice. Welcome to the program, Amanda and Kara. Tell me a little bit more about what you guys are doing with mental health and older adults. And I think when we're saying older adults, we mean people over 65, right?
Yep. Yes, so Caring Connections is an intensive outpatient program, and that's a really big, long way of saying it's mental health treatment for older adults. The intensive part of our model is that our patients are with us multiple days a week usually. We are addressing common concerns like depression and anxiety, grief, loneliness, isolation, all those things that are not necessarily specific to the 65 and older crowd, but can be exacerbated in that age group.
Now, I have a question, because I think sometimes folks that are a little bit older, when they were younger, you know, mental health issues had a different kind of stigma, and it's come a long way in recent years. But I feel like a lot of those folks might be afraid to actually look into getting mental health help or services. Is that something that you guys have to deal with?
Absolutely, frequently. And I would say the number one thing I hear from patients is this mantra of, I realized I'm not alone. They recognize that making these connections with other patients, that they are not alone in the very difficult issues that they're dealing with.
Now let's talk a little bit about like some of the ways that you guys treat, because I imagine that also when people understand what they're getting into, it probably helps them feel more comfortable. So what does your program look like?
So we're group therapy, which means that we do our group sessions or our counseling within a small group setting. Generally, our group sizes are about 4 to 8 patients at a time, but we can have up to 12. That, you know, going back to the stigma piece, is something that older adult population tends to be concerned about as well, because that's not something that they're used to. But what they find in the group setting is that there's a lot of camaraderie that tends to occur.
There's a social element or a community aspect.
Yes.
Okay.
Yes. Exactly. Yeah. Whereas a lot of our patients are isolated and lonely, and so they find that piece comforting as well.
Now, are you guys focused on therapy, or is there a psychiatry?
Psychiatry.
Okay.
Yeah, both. Yes.
So it's both. It's a blend of the two?
It is, yeah. So our patients meet with Kara and I every day that they're in group sessions, and then they meet with our program psychiatrists regularly throughout the program.
Okay, now what about things like transportation, or, you know, I know some folks, you know, they've got schedules and, you know, maybe, you know, they have a certain meal plan or schedule that they're part of. Like, how do you guys make room for people that have, you know, a way that they do their lives?
Yes, so we're very fortunate that with being part of the Gibson Area Hospital system, that transportation can be provided for our patients. Some of our patients prefer to drive themselves because they like that freedom, and other patients gladly want to take the ride to and from group, and it's free. It's part of the program. Additionally, what was your other question? Oh,
just like, you know, if there is, what time is this? Is it like early in the day, or is it like in the evenings? Is it over lunchtime?
So our patients are expected to arrive around 9 a.m. and they stay with us until about 1 p.m. Some of our patients choose to come the full 4 days a week, and some come 1 or 2 days a week.
So there's some flexibility built into it.
Absolutely.
Awesome.
We want to make sure that we're catering to the individual needs of each patient.
Now, is this like something that is covered by insurance or Medicare? How does that work when it comes to costs and payments?
Yeah. So our primary payer is Medicare. With patients who have both Medicare and a supplement, there tends to be no out-of-pocket costs to them. So that's usually the best combination, but we also take Medicare Advantage plans, and we like to check those coverages before patients begin the program.
Oh, that's really incredible. So we're just about out of time here, but you guys have some upcoming events, and they're actually free to the community. People want to come check them out?
Yes, so on January 19th in Gibson City at the Education Center, which is south of the Dollar General, We will have a community event where we'll be painting. You can find more information about that on our Caring Connections Facebook page. It is free to seniors over the age of 65. We're not checking ID, so no need to be concerned about that. Also, this hasn't been completely set in stone yet, but we're hoping by the end of the month we will have an open house for the community because we just moved to a new location in Gibson City.
Well, awesome, and congratulations on the new location. Kara and Amanda, thank you so much for joining us today.
Thank you.
If you would like to learn more about Caring Connections in the Gibson Area Hospital, we're going to connect you at our website. We thank Gibson Area Hospital for sponsoring this segment today.